Hello and welcome back to Expert Exercise Facts and Fictions. My name is Trent Cook, and today we are going to be looking at a particular bugbear of mine titled, Is Your Professional Assessing or Guessing? Basically alluding to the fact that I think far too many exercise professionals, far too many injury therapists actually don't do a deep enough dive into assessing their client's overall postural position before they embark upon strength training, particularly, or injury type therapy. So we have a very much a model of this is the best start for you in strength training. Nice easy start. The A, B, C, D, E, F, and G are the easiest exercises to kick you off with. Or if it's exercise therapy someone potentially needs, then they'll look, this person's got a shoulder injury, they'll just look at the site of the shoulder. They won't address the whole actual musculoskeletal system, which actually can give you a lot better insight as to how an injury has probably occurred. So if you look back over the core episode, you'll learn very easily that the most important muscles we have stabilize the pelvis and the lumbar spine. Now, most weaknesses will come through that region first and then start to ripple and reflect through the rest of the body. So in my training, over 30 years, many qualifications and courses, and also working with many human beings, like the amount of people I would posturally assess a year, on average is about 500. And that's 500 different people a year, let alone the amount of times I repeat assess someone's posture throughout a year or over the years, means that I'm doing many posture assessments, and 99% of the time, that leads you towards the right result, whether they've got a knee issue, a shoulder issue, or what I primarily deal with is lower back type issues. So I'm going to put lots of charts up in this presentation. It's going to be a reasonably long-winded one. I apologize for that, but there is lots that can go on with someone's overall posture and cause a myriad of problems throughout the person's entire body. So if you're not assessing it and you're therefore designing a prescription, whether that's just a normal strength training program or actually some kind of injury correction strategy, and you haven't assessed that person's overall posture, you are flat out guessing at what the solution is. And I see numerous people that have bumped off extremely smart therapists that are out there, potentially maybe good personal trainers that are out there, but they're not helping the person because they're just doing what they think is good, what they think is right. And they'll do something that's fairly general, something that's fairly textbook for maybe that injury. And it's not actually going to help the individual. You might find that there is a success rate with that process, and maybe 20% or 80% of people will actually benefit from that. As long as you don't go particularly with the strength training side of things, as long as you keep the intensity comfortable, then the person will probably benefit from it, absolutely. But particularly most human beings have some kind of musculoskeletal weakness, particularly with regard to our core muscles, our major joint stabilizers, our transverse abdominis, our gluteus maximus, our spinal stabilizers, our rotator cuff. These muscles can become dysfunctional very easily. And if that's not addressed, then you are actually working closer and closer to someone's injury risks. Now, in my line of work, I actually help fix and correct injuries and pain and that sort of thing. And I know I am dead set working blindfolded if I'm not actually assessing that person's posture. So we're going to look at some very basic methods of how to actually assess someone's posture so it can get you to actually doing a program that's productive, and therefore then how can you keep reassessing to make sure you keep heading that person in the right direction. Because there is no one exercise or exercise program in a period of time that's the best, that's just guaranteed to work. Everything's actually a process of assess, implement, reassess, re-implement, and continued on. Typically, the textbook says to take someone from terrible posture to good posture, it takes about 12 weeks and 3 program adjustments. So we're talking about a process here. So no miracle cures. But if someone's had terrible posture all their life and you could actually look at maybe 12 weeks improving that quite significantly, then that's a pretty good solution. And it's actually not that hard even to correct someone's posture, or at least improve it. The older someone gets, and there's other specialist conditions as well, means maybe it's somewhat impossible to completely polish that posture, but you can actually make pretty good inroads into improving it quite significantly with fairly simple processes. But you do have to analyse and know what direction you're trying to take the person, because people get back pain all day, every day. 96% of westernised population will have a significant bout of back pain in their life, and most of the time that's posturally related. Yes, you can have incidents and accidents that cause it, but even those incidents and accidents, if not dealt with properly through rehabilitation, will actually turn into bad postural faults later in life that generally I deal with. So we'll talk about the different types of postural problems throughout this episode, and therefore also methods of how you can actually go about correcting it. Also, additionally, how you could do a very simple test at home to see how good your postural muscles actually are. There's a really simple test. I don't do it because it's a little bit too simple, but I do lots of actually measuring of angles of the skeleton and the important areas to go from there. So if you're not assessing, you're guessing. Where to begin? I like to begin with a static posture assessment. I guess ultimately reverse back. I like to question my clientele, like find out why they're working with me, what they need help with. But yes, any form of pain or discomfort or musculoskeletal improvement they need, the first thing that I'm going to base my exercise program on is a static posture assessment. So basically have the person stand up and I'll take certain measurements. I'll put some pictures up here that you can see different areas of the body that you'll take measurements of. Particularly you're trying to measure rib angle, first rib angle, the cervical spine, the thoracic spine, the lumbar spine, the pelvic orientation, and basically make the program start with amending any faults. So find a fault, fix a fault. It's not a matter of you trying to do that from a safety point of view. There will be aspects of that, but even if I'm guessing with a program, I'm always trying to be safe. What this is it will tell me what's going to be safer because I'm going to strategically work through actually fixing areas of the body that aren't working properly. If someone's posture has become faulty, it's because their joint stabilizers 9 times out of 10 are not coordinating correctly and operating correctly. Whether they've become weak or they've become inhibited, there will be a few of them that are actually, as a cascading event, causing that postural position to change. Through strength training, you can actually quite comfortably amend a lot of those postural faults. Now, strength training needs to be done 2 to 3 times per week anyway. So, okay, cool, the SAFE program is awesome, but a highly productive program to actually improve posture and core strength, etc., it's a win-win-win-win-win all day long. So design a smarter program based on doing smarter things, which is assessing fully, not just a particular thing like assess cardiovascular fitness or assess shoulder stability. Assess the whole damn kit and caboodle. You might as well, because if there's one problem, there's probably 2, there's probably 3, there's probably 10. And if you don't go into it eyes completely wide open, then you're probably not going to help the person. And in fact, I'll go as far as to say you won't help the person as well as you can if you actually address everything. 9 times out of 10, a shoulder issue, a hip issue, a knee issue is actually been a creation of a lumbar spine and a pelvic issue anyway. So you have to address it. Therefore, why aren't you assessing it? Because you want to guess. The textbooks sometimes that are out there have gone, with this injury, you do A, B, C, D, and E. And it doesn't work because you're actually not addressing the pelvis and the lumbar spine. It's kind of pigeonhole therapy, pigeonhole programming. I've always likened it in my education. It's like looking out that window over there and going, gee, it's a nice day out there. But then out that window over there, there's a storm coming. But because you only want to look there, you don't see the problem arising. So we're a very dynamic entity, musculoskeletal, coordinated body. Everything relies on everything. The knee bone's connected to the shin bone. Whoever wrote that song was a bloody genius. And you need to actually be assessing everything. So we'll look at a few of the major areas that change easily through many incidents and accidents and wear and tear over life, particularly like I was talking about in the core program, your pelvis and lumbar spine, or what's in between them, which is called your sacroiliac joint, is pretty well the most important thing to assess. So for men, it should have a rotation forward, your pelvis, and I'll put some slides up here for you, some pictures. It should have a rotation forward of about 4 to 7 degrees. Females should be about 7 to 10 degrees. Obviously, there's some slight differences in men versus women's skeletal structures, which I'm going to do a deep dive into with an episode I'll do specifically on female complexities, which will be an important one to consider. So slight extra rotation forward for females to be considered normal. And as a result of that, you then have a lumbar curve come off, or from attachment from the pelvis, or the sacroiliac joint will come off and curve, and should be about a 30-degree angle. So at the sacrum, it should be 15 degrees, and at the junction between your lumbar spine and the thoracic spine, it should be about 15 degrees. And when I say about, I mean exactly. Your pelvis and your lumbar spine are the most important structures to get Mickey Mouse right. You need to have them perfect because the rest of the body has to sit on top of it. There is no point worrying about thoracic angle and shoulders retracting and depressing and forward head posture, etc., if you do not have a solid base under it. That would be like having a building with a cracked, warped foundation and then putting $1 billion roof on top of it. It's not going to sit well over a longer period of time. It's just going to fall apart because the structure underneath it is so important. And our sacroiliac joints, our pelvis and our lumbar spine are the most important structures to make sure are fully functional, fully stable, so we can shoot a cannon from a canoe. You need to go back over that old episode, the What is My Core episode. So pelvic orientation is extremely important. You can see it very simply side on someone's posture, and I've no doubt put some pictures up there so you can analyse these things. The concern is pelvises can tilt far too far forward, so we call that an anterior rotation, or they can roll too far backwards. Again, pictures up there. And cause ripples through the rest of the spine. As you will have seen in those pictures, when a pelvis rolls too far forward, the lumbar spine will become extremely overcurved. So that actually can create isolated lower back discomfort, basically through tightness. Those muscles in the lower back will become extremely tight as a result, and it's usually occurring because abdominal muscles, gluteal muscles, and hamstring muscles have actually become weak and inhibited. So you need to address those weak muscles, not working muscles, to start straightening up the posture, and then the lower back muscles can actually be loosened off a little bit and not have to work so hard. So whereas if a pelvis rolls backwards or posteriorly rotates, then you can see in the picture diagram there that the lumbar spine would typically flatten out or reduce in curvature. What that can do is actually pull on the spinal cord, which is the key, or the key result to that is sciatic pain down one or both legs, which I'll deep dive into why one leg, not two legs all the time. But yeah, basically you'll get a lower back type pain from that posture, but it usually turns into a radiating type pain. So you can half kind of diagnose these things with regard to what type of pain the person's in. If it's an isolated lower back pain, it's probably an anterior rotation with a hyperlordosis, or if it's a pain that kind of radiates down into their hips and their buttocks and down their hamstrings, backs of the knees to their feet, those sorts of problems, then it's usually their pelvis is rolling backwards with a flattening of their lumbar spine. Once upon a time, the textbook did not recognise that that posture existed. When I went through university study initially, they did not recognise anything other than an anterior pelvic rotation with a hyperlordosis. Obviously kyphosis as well, but we haven't got to that one yet. Whereas now the textbooks had to evolve and actually recognise that these different postures actually exist. So hyperlordosis, reduced lordosis is kind of your second key ingredient to make sure you're addressing, because it's a reflection of the pelvic angle. Therefore, that's primarily number one, but very second to it, very close second. Photo finish type scenario is that lumbar spine position. And there'll be specific exercises that'll actually help with that. I'm not going to prescribe exercises in this particular session, but what is good for one posture is horrible for the other. So if you have a flat lumbar spine and you give it an exercise that's good for a hyperlordosis, it is going to hurt that person more. So the easiest rule is no pain, no gain does not work. So again, I'll do an episode on that because that deserves its own airtime. But you can tell if you as the client should be able to tell if the exercise is bad because it hurts. It's as simple as that. If it hurts, it's bad. Stop doing it. The exercise is wrong for whatever postural problem you actually have. It's the easiest rule out there. So moving up to the thoracic, you can have two different types of thoracic postures. We call them upper cross syndromes. You can have kyphosis, which is like the hunchback scenario, forward shoulders, forward head, ribs dropped, an elongated curve. No doubt I've put a fancy picture up there for you. You will have seen it all day, every day, with people everywhere in your life suffer from kyphosis. Kyphosis only exists because of lower cross syndromes, being the pelvis and the lumbar spine problems. So address that first. With kyphosis, the opposite posture to that's called military spine. You won't deal with it very often. I've only ever dealt with it half a dozen times in my whole 30-year career, and it's been typically surfers. So where a surfer will basically, to paddle out to get the wave, they'll invert their posture, and they can end up actually creating themselves some mischief with straightening out their thoracic posture. I've put a picture up there. It's quite rare. I'm not even going to delve into it too much. It does need a very specific exercise program like all postural problems do. The most common postural problem out there is kyphosis, and we need to deal with that one with regard to, it's the easiest one to analyse because effectively to end up in kyphosis, you've got extremely tight and dominant through the chest and extremely weak and long in muscle through your upper thoracic. You need to focus on strengthening what is weak and loosening / stretching what is strong. But what we have learned about stretching is that it doesn't benefit a great deal. So we need to do active stretching. So I tend to just try and choose exercises that will actively stretch the chest out, whilst also trying to strengthen up what's in the back. And again, I talked about these muscles in the What is My Core episode, so it's quite important to go back over that one. So as part of thoracic kyphosis, that links intricately towards scapula that can't retract together, so your shoulder blades actually being able to pull together, and also your rotator cuff function. So you need to make sure you're working on scapular retraction, a retractability, an elevation of the ribs as a result of that retraction, which will shift the shoulder girdle back, which will then allow your rotator cuff to actually rotate better to actually stabilize your shoulder. So something I glossed over a little bit too rapidly was the pelvic angle. So for a long period of time, we believed the pelvic angle could not twist. We believed there was a massive amount of ligament, which there is, a massive amount of ligament around the sacroiliac joint, and that was an immovable joint. But what we've learnt is through ligament laxity and flexibility, like women having babies, etc., loosening off the pelvic region, that sacroiliac joint, those ligaments that hold it, can actually loosen it off, and it can actually twist off axis. So it's what we call a nutated or a counter-nutated pelvis. And it's extremely important to deal with first and foremost, and there can be some complexities with it. So if your pelvis rotates too far forward, so you have a left and a right side of your pelvis, if it rotates too far forward but one side further than the other, that's called a nutation. If your pelvis rolls too far backwards, one further than the other, then that's also a nutated pelvis. So you've got anterior nutation, you've got posterior nutation, but then you have a counter nutation. So counter nutations are extremely hard to deal with, and I'll probably put a whole episode together on SIJ dysfunction and explain this more fully. But basically it is when either the left or the right side of your pelvis, one goes forward of normal and one goes backwards of normal. Now that creates a dirty, great big helix twist through your pelvis, kind of like a corkscrew effect, quite often diagnosed as a scoliosis under X-ray. It's not quite right with its diagnosis. It's not just a straight snake curve. It's actually a corkscrew. If you correct the pelvic alignment, you go a long way to actually correcting the corkscrew of the spinal curve. So dealing with the pelvis first and foremost is a very important thing. It's quite complicated too, and it does deserve its own episode, so I will do that. So I put a bit of a chart up here to explain some of the postures, so how it looks, so you can have a little bit of a look at it a little bit deeper, so you can start to recognize that maybe this is how I look, or maybe other family members, etc., this is how they look. So your first fairly textbook's been around for a long period of time is your hyperlordosis with kyphosis. So that's how that posture looks. It's very much a weak abdominal muscle, weak gluteus maximus, weak spinal muscles, weak upper thoracic. There's lots of weakness in that posture, and therefore strength training will be highly beneficial. Exercises that help lengthen that person back out are extremely important. Do not compress that person anymore. They're already reduced in height enough with those overcurvatures in the spine in particular. So focus on the key areas: upper thoracic, spine, abs, glutes will go a long way to actually helping initially that person. We then flip to the opposite posture, which is basically a flat lumbar spine. We call it a flat back posture, where the pelvis is rotating posteriorly. This person tends to also have kyphosis more typically. And hey presto, we need a very opposite program. The abdominal muscles are dysfunctional, but differently. The gluteal muscles are dysfunctional, but differently. You need to choose different gluteal exercises and sometimes abdominal exercises as well. Spine is usually uncoordinated, strong in some areas, weak in others. But something like your bird dog, your alternating Superman exercises go a long way to helping this person. And then again, it's the same thoracic type problem, so scapular retraction, rotator cuff type muscles. But this is the person, remember, that gets sciatic pain down their legs, and that is bad. You can cause big problems with that person if you give them the wrong exercise to do. So my advice is don't muck around with these things. Find an expert to be able to write you a program like myself, and hey presto, you'll be a little bit more assured that you're doing the right thing. But you need to be doing exercises that help increase your lumbar curve and help your pelvis roll back forward. Easiest rule in rehab: if it feels bad, it probably is bad. Stop, because you can cause a disc bulge and irreparable damage. And when I say irreparable, you could repair it, but it's major spinal surgery, which you probably don't want. So you've got to be super careful with that posture. Then you've got your twisted pelvic alignment postures. They are super challenging to deal with because a lot of professionals, one, the exercise fitness industry doesn't know it even exists, and then a lot of other therapists don't really know how to deal with it very well either, because they're off trying to fix hips and shoulders and different things and not really worried about even analysing the actual nutated, or worse, counter-nutated pelvis. Again, I'll do an episode on that later. SIJ dysfunction, it's a deep, deep issue that's so common with everyone walking around there. If you've had a lack of success with different treatments for all sorts of different musculoskeletal problems and you just haven't found any success, it's probably because you've got a counter-nutated pelvis, and I haven't found a therapist yet that deals with that very well, except for those who do analyze posture thoroughly. So moving into then, once you've got your exercise prescription going with your client, like start fixing something. A 4 to an 8 exercise program will be nice, and you do less to start with and work on more later. You need to analyse how that person moves or doesn't move. So looking at fairly common movement patterns like walking lunges, balancing exercises like lumbo-pelvic rhythm, like a single leg good morning or waiter's bow or RDL, whatever you want to call it. Looking at those types of functional movements can show you a lot about how that person's pelvis and lumbar spine actually work or don't work. So if a person doing a walking lunge is really struggling to balance, then you know that their core muscles are not coordinating whatsoever. If a person rounds their or flattens out their lumbar spine dramatically when they're trying to do a good morning or waiter's bow type movement, then they have a lack of coordination between their spinal stabilizers, their gluteal muscles, and their hamstring muscles, which can go a long way to actually causing that flat back posture that I put on the screen there earlier. So don't force the issue. Don't try and overly correct things with regard to techniques. Move to actual more isolated exercises to correct that problem, to then move back into functional exercises ASAP. The more important areas to really hyper-focus on is spinal coordination. So a person needs to be able to super stabilize during bird dog, alternating Superman type exercises, solid kind of 3-second hold on each side. And I just hound clients, hey, how easy is that Superman got? And they go, oh, still a bit wobbly. Oh, well, you get it in the next program then. Until they come back and they tell me it's super easy and I could see them do that, it is actually just a walk in the park, then they keep getting that exercise until they've done enough repetitions to completely stabilize and counter-rotate their spine correctly. Gluteal dysfunction's a really complex one because it does intricately relate to those postures that I showed you before. Our brain kind of has 3 different motor programs for glutes. It has a glute activation program for when we are face up, so laying on our back, another one for when we're face down, and another one when we're upright. And what you can actually have is someone that's glutes work in 1 or 2 of those programs, but not all 3. So their glutes are kind of functional in upright, functional in face down, but not functional in face up. And you need to fix the one that they're dysfunctional in. Sometimes it's that they don't have a program for any of them. Their glutes are completely shut down through a myriad of injuries and accidents over their lifetime. And you need to actually address all of them over a period of time. But you need to address which one you can address without increased pain. Pain is the biggest muscular inhibitor we have, and our brain will actually shut areas down, not wake them up and strengthen them. So it's kind of counterproductive to push through pain. No pain, no gain doesn't work. We've known that for a long time. Certain therapies have pushed that for a long period of time, and I'm hoping they've also learnt their lesson. The smarter ones have anyway. The not so smart ones are still flogging the hell out of people. So you need to stop doing that. Pain is a message that something is bad and going wrong, and what will be the end result is your brain will actually turn those muscles off and inhibit them. And we don't want that. We're trying to get these muscles actually activated. So different glute programs is important to consider. We tend to have face down glute exercises, face up glute exercises, standing up glute exercises. We need to make sure they all work fine. A real simple one for me is you tell a person, oh, when you walk up a hill, where do you feel the fatigue? And if they say in their quads and their knees, then you know that their glutes are potentially not working. And then you ask them, do you feel it in your glutes? And they're like, no, I don't feel it in my glutes, it's all quads. If someone's a cyclist, then ask them when they ride their bike up a hill, do they feel their glutes fatigue? And no, it's all quads. You go, okay, well, you're quad dominant because your glutes have stopped working. So you know you're going to have to put focus into getting those glutes happening. So there's a few things that you can deep dive with and ask yourself or ask your clients to. It will lead you into the fact that, okay, this person's glutes are dysfunctional. And it's very, very common, unbelievably common. Okay, so moving up into the, sorry, not up, down into the abdominal muscles. So you need to make sure that person can brace their core correctly. They can draw their abdomen in to work that transverse abdominis correctly, so you can be stabilizing your pelvis from the front, not just with the glutes doing all the work at the back. Again, I'll do another video at some point on how to brace your core properly, etc. So, but draw your abdominal muscles in, make yourself as skinny as you can when you start your repetition, and hey presto, you'll go a long way to stabilizing your core. Moving up to the upper body, you need to be able to thoracically retract your scapula, so elevate your ribs, straighten up your thoracic and retract your scapula together fully. Hopefully I've got a nice little picture up there for you. And we also need to be able to rotate our rotator cuff in a coordinated fashion. So lots of these movements you can actually analyze as the person does it. So if I shuffle back here and I'll give you an example of rotator cuff rotation. So if a person can keep their elbows up reasonably level, rotating like so, and that looks nice and smooth and coordinated, rather than someone doing something like that where they drop their arms down, or they drop one arm down and one arm stays up. They do all sorts of weird, uncoordinated things in their movements, and that goes for hip movements and spinal movements. If there's things that don't look quite right, or if they feel bad, or you don't feel the correct muscles working, then these are things that need to be addressed. Everything is telling you something. If it doesn't look right, it's probably not right. If you're not feeling it in the right area, it's definitely not right. And if you're in pain, you're making the problem worse, not better. These are very crucial ingredients to actually analysing movement. Not just looking at the movement, but asking the person questions and having the person answer specifically as to what they feel. So, very important to add that, because that's then going to be combined with your static posture assessment, what's improving and what's not, as to how you progress that person's program over time. With the line of work that I do, I tend to progress someone's program every 4 weeks to 8 weeks, depending on how long it takes them to improve. Some people are quick improvers, some people are slower improvers. Give them all the time they need to improve, but we don't want to do an exercise program for longer than 12 weeks. 12 weeks is kind of a maximum, particularly for a strength training program, and we need to make sure we're changing and adapting and analysing and getting our people going with a variety of exercises. Okay, to wrap this all up, 2-minute, 3-minute summary. If any of this struck home with you and you're in pain, you need to find yourself a posture correction expert. Now, that's typically an exercise physiologist, but you do need someone who's going to measure and assess your posture correctly and have methods of reanalyzing your posture correctly. If they're saying, hey, you just go do this couple of weirdo exercises and you'll be fine, then they are barking up the wrong tree. You need a proper strength training, joint stability program done for a typical period of time, which is anything between 4 weeks to 12 weeks. That, again, depending on how quickly you improve. And you need to be reassessed and re-prescribed exercises. And it needs to happen in a consistent fashion. Once you get people kind of further down the line and they're kind of feeling a lot better and a lot stronger, then generally we just need to change their program around every 12 weeks because, funnily enough, people need to keep strength training. Individualized strength training has been found to be key. Group scenarios, Pilates, yoga, those sorts of things have been found to be beneficial as part of that routine, but not on their own. Not on their own. So if you're the type of person who's out there doing Pilates 3 and 5 days a week, that sort of thing, and that's the only strength training you do, then it can be a very good idea to seek professional help with regard to getting an individually tailored strength training program up and running for yourself as well. Make sure you're assessing. If you're not assessing, you're guessing. And at home, here's a little take-home test for you. Everyone's done a plank, most likely. I'll put a little caption up here of a plank being done well. Now, a plank should be experienced, the fatigue and strain should be experienced in your abdomen. It's not saying that it shouldn't be elsewhere, but it shouldn't be significantly in your neck, and it definitely shouldn't be in your lower back. So if you experience the plank position, when you're in the plank position, If you experience that in your lower back or your neck, then you need to stop, because that's bad. And that will tell us that your core is not engaging correctly, certain muscles are out of whack. So then you need to probably go and seek better advice with regard to getting your posture properly analysed, because you could have any of the different postures. I'll put a picture up there of a person doing a plank with an overcurvature in their lumbar spine, and a picture of a person up there doing a plank with a reduced lumbar spine angle, and they do look very different, and they will experience different levels of discomfort. The overcurvature typically will feel it in their lower back, and the flattened lumbar spine will typically feel it up in their neck or their thoracic, but they can also feel it in their back. You should be able to do a plank for probably 2 to 3 minutes, technically 3 minutes, because that's the end of the anaerobic system's capacity, but being domestic cats, civilized human beings, 2 minutes would be a good level to be at. If you can do that, experiencing your core with nice, flat, technically correct technique, then you probably don't have an issue. Far too many people are in pain these days. Far too many people think back pain and joint pain is just normal. It is not. It is an indication that something is wrong, and that can usually be reflected and analysed through your posture. So if you're not assessing, you're guessing, go to someone who's going to properly assess your posture, design a program around your weaknesses, and guide you through upgrades to those programs by continually analysing you, and you'll end up with a much better future musculoskeletal system that will trudge you through your future quite nicely and make you nice and fit and healthy without all the pain that you could possibly be experiencing. So there's probably a fair few questions that can arise from this one, especially from a very individualised point of view. So feel free to put comments and captions and whatever in your comments box there, and I'll do my best to get back to you. But it's not an episode where I can give individualised help as such, but it can alert someone to problems that they may be having that they need to get expert help with. So, but anyway, please like and subscribe. Feel free to comment. I look forward to hearing from you, and see you on the next episode. See ya.